If you are over 60 and you have been noticing that your memory just is not what it used to be, before you blame your age, I need you to look at what is sitting inside your medicine cabinet. I am Dr. James, a real licensed physician, and in my years of clinical practice, I have sat across from patients, sharp, intelligent adults, who were convinced they were developing dementia. Their families were scared, their doctors were talking about specialists and brain scans, and in many of those cases, the culprit was not their brain aging at all. It was their prescriptions, common medications. Medications prescribed for sleep, for anxiety, for bladder control, for cholesterol. Medications that may be sitting in your pill organizer right now. And the most frightening part? Nobody warned them. Not the pharmacist, not the physician who wrote the prescription. Nobody told them. Researchers at the University of Washington tracked over 3,000 adults for 7 years and found that regular use of certain common medications increased the risk of developing dementia by as much as 54%. 54. And several of these medications are sold over the counter. You do not even need a prescription to buy them. Today, as a real licensed physician, I'm going to name all 7. I will explain exactly what each one does to your aging brain, and I will give you the specific questions to ask your doctor, starting this week. If you are new here, this channel exists for one reason: to give you the honest, evidence-based medical information your doctor should be sharing at every appointment, but often does not. Subscribe right now so you never miss what we cover. Now, before I name the first medication, I need you to understand something critical. These side effects feel exactly like normal aging. You forget a name, you pause mid-sentence, you walk into a room and stand there trying to remember why. And you tell yourself the same thing everyone says: this is just getting older. That belief is precisely what makes this dangerous, because once you accept memory loss as inevitable, you stop questioning the pill that is causing it. Stay with me for this entire video, because number 3 on this list is the one that shocks my patients the most when I explain it in my office. And if you take this medication right now, what I tell you next could change everything. Number 1. And I start here because this medication is available at every pharmacy without a prescription. Diphenhydramine. You know it as Benadryl, as ZzzQuil, Tylenol PM, Unisom. Millions of Americans over 60 take one of these tonight to sleep. And every single night, it is blocking a critical chemical in their brain called acetylcholine. Acetylcholine is your brain's primary memory chemical. It is what allows brain cells to communicate, form new memories, and retrieve old ones. Block acetylcholine and you block memory formation. It is that direct. Here is the problem after 60. Your brain already naturally produces significantly less acetylcholine than it did at 40. So when you take a medication that blocks what little remains, the effect is not mild. It is measurable. And research published in the Journal of the American Medical Association Internal Medicine showed that consistent use of medications in this category can begin causing cognitive damage in as little as a few months. In fact, this entire class of drugs, called anticholinergics, is listed on something called the Beers criteria. That is the American Geriatric Society's official list of medications considered potentially inappropriate for adults over 65. I had a patient, a 69-year-old retired teacher, who came to me convinced she had early dementia. She was confused, forgetful, struggling to find words mid-sentence. When I reviewed all of her medications, she had been taking ZzzQuil every single night for 3 years. 3 years of nightly acetylcholine blockade. Within 6 weeks of stopping, under my careful supervision, her cognitive sharpness began noticeably returning. This is not a rare case. I see versions of this story regularly. Now, the next medication on this list is more dangerous, because your doctor may be actively prescribing it for anxiety or sleep right now. Number 2, benzodiazepines. Xanax, Valium, Ativan, Klonopin. These are prescribed for anxiety, panic attacks, and insomnia. They work. They calm the nervous system. They slow racing thoughts. They make sleep feel possible, but there is a price. A study published in the British Medical Journal, one of the world's most respected medical publications, followed patients over several years and found that those who used benzodiazepines long-term had a 66% increased risk of developing Alzheimer's disease. 66%. Here is the mechanism. These medications enhance a brain chemical called GABA, your brain's natural braking system. That is how they calm you. But they suppress the brain so broadly that memory consolidation, the process your brain uses during sleep to lock in what you experienced that day, is significantly disrupted. And after 60, your liver breaks these drugs down more slowly, which means the brain suppression intended to last hours can linger for days. I had a 71-year-old patient who had been on Xanax for 5 years for generalized anxiety. Her family brought her in worried about dementia. What she had was not dementia. It was benzodiazepine-induced cognitive impairment, a recognized medical phenomenon that is frequently misdiagnosed as early Alzheimer's. We tapered her off carefully over several months, and I want to be absolutely clear. Never stop benzodiazepines abruptly on your own. Sudden cessation can cause dangerous withdrawal, including seizures, only under physician supervision. But once she completed the taper, her memory measurably improved. Now, number 3. This is the one. This is the medication designed specifically to help you sleep that is quietly doing something to your brain while you sleep that your doctor has never explained to you. Number 3. Zolpidem, brand name Ambien. One of the most commonly prescribed sleep medications in America for adults over 60. You fall asleep faster, you stay asleep longer. It works exactly as promised. But here's what the research reveals, and this is the part that permanently changes how my patients look at this medication. Your brain does not just rest during sleep, it cleans itself. There is a system called the glymphatic system, essentially your brain's waste removal network, that only fully activates during a specific stage called slow-wave deep sleep. During this critical window, your brain flushes out toxic proteins, including amyloid beta, the exact proteins associated with Alzheimer's disease. Zolpidem disrupts slow-wave deep sleep. You feel like you slept. Your clock says 8 hours, but your brain's cleaning system barely ran. Night after night, those toxic proteins accumulate. Research from the National Institutes of Health confirmed measurable reductions in slow-wave sleep in adults using Zolpidem. The FDA has specifically issued warnings recommending lower doses or alternative approaches entirely for adults over 65. I had a 73-year-old retired engineer who described it perfectly. He said to me, "Dr. James, I sleep 8 hours every night and I wake up feeling like my mind is wrapped in cotton. That cotton feeling, that heavy mental fog in the morning, is your brain struggling without its nightly cleaning cycle." Falling asleep is not the same as restoring your brain. That distinction may be the most important sentence in this entire video. Number 4 is the medication that almost nobody connects to memory loss, because it is prescribed for a completely different part of the body. Number 4, oxybutynin, brand name Ditropan, prescribed for overactive bladder. If you or someone you love takes a bladder control medication, this section is absolutely critical. Oxybutynin is one of the most potent anticholinergic medications available by prescription. Remember medication number 1, diphenhydramine, which blocks acetylcholine and interferes with memory? Oxybutynin does the same thing, but more aggressively, and it crosses the blood-brain barrier efficiently, meaning it reaches your brain and directly blocks the pathways responsible for memory formation. Brain imaging studies using PET scans have shown measurable reductions in metabolic activity in the memory centers of the brain in adults taking oxybutynin regularly. This is not a theoretical risk. This is visible on a brain scan. And here is where it becomes critical. Many adults over 60 are taking oxybutynin at the same time as diphenhydramine at night for sleep or a tricyclic antidepressant for nerve pain. The combined anticholinergic burden on the brain multiplies. I have personally seen patients on 3 anticholinergic medications simultaneously, each prescribed by a different physician with none of them aware of what the others had prescribed. There is a safer alternative for overactive bladder, a medication called mirabegron, which works through a completely different mechanism without the anticholinergic cognitive effects. Ask your doctor about mirabegron by name. That is a real, clinically validated conversation to have at your next appointment. Number 5 is taken by tens of millions of Americans daily, and its cognitive connection is something the FDA formally recognized but almost never reaches the conversation at the pharmacy counter. Number 5, statins. Atorvastatin, simvastatin, rosuvastatin. If you are over 60, there is a very strong chance you or someone at your dinner table takes a statin for cholesterol. I want to be clear, these medications have saved lives. The cardiovascular benefits are real and well documented. But the FDA added a formal label warning in 2012 specifically acknowledging cognitive side effects, including memory loss and confusion associated with statin use. Research suggests that up to 1 in 5 statin users experiences some degree of cognitive impact. The mechanism. Your brain is approximately 60% fat. Cholesterol is not just something that clogs arteries. It is an essential building block for the connections between brain cells called synapses, and for the protective coating around your nerves called myelin. Fat-soluble statins, particularly simvastatin and atorvastatin, cross the blood-brain barrier and can suppress cholesterol production inside brain tissue itself. The important clinical nuance. For most people, the cardiovascular benefit outweighs the cognitive risk. I am not telling you to stop your statin. I am telling you that if you have noticed increased mental fog, confusion, or memory slips since starting a statin, that is a medically relevant symptom. Write it down. Bring it to your physician. Ask specifically, could my statin be contributing to these cognitive changes? That is a legitimate medical question with a legitimate evidence-based answer. Number 6 is taken by many adults over 60 for depression, nerve pain, or even migraine prevention, and almost no one has been warned about its cognitive burden. Number 6. Tricyclic antidepressants. The most common, amitriptyline and nortriptyline. These are prescribed for depression, but also very commonly for nerve pain, chronic migraines, and sleep. Many patients taking these medications do not even realize they are on an antidepressant. They were told it would help with their nerve pain. Tricyclic antidepressants carry one of the highest anticholinergic burdens of any medication in common clinical use. We are back to that acetylcholine blockade, the same mechanism as medications 1 and 4. But in tricyclics, the blockade is particularly aggressive and sustained. The good news? There are equally effective alternatives. SSRIs and SNRIs, newer classes of antidepressants, carry dramatically lower anticholinergic burden and are effective for depression. For nerve pain specifically, gabapentin or certain topical preparations may be appropriate alternatives depending on your clinical picture. If you are currently on amitriptyline or nortriptyline and you have been experiencing memory changes or cognitive fog, bring this directly to your physician's attention at your next appointment. This is not a minor side effect to be managed quietly. It is a recognized, documented risk that can often be mitigated by transitioning to a lower burden alternative. Now, number 7. This one is the medication that surprises people the most because it is widely considered one of the safest long-term drugs available. But what it does quietly to your brain over years is something you absolutely need to know. Number 7. Metformin, the most commonly prescribed type 2 diabetes medication in the world. And I want to be careful here, because metformin is genuinely a very safe and effective medication for most people with type 2 diabetes. The benefits are significant and real, but long-term metformin use depletes vitamin B12. Not in some patients, consistently, progressively, and silently. The mechanism. Metformin interferes with B12 absorption in the small intestine. Research published in the Journal of Clinical Endocrinology found that up to 30% of long-term metformin users have measurably low B12 levels. And B12 deficiency causes memory problems, mental fog, confusion, difficulty concentrating, and cognitive decline. Symptoms that are virtually indistinguishable from early dementia in a standard clinical visit. I have had multiple patients referred to me with suspected early Alzheimer's disease. After a thorough blood panel, their B12 was critically depleted. After B12 supplementation under proper medical supervision, their cognition improved dramatically. A 68-year-old patient of mine had been on metformin for 11 years. He came to me convinced something serious was wrong with his brain. His B12 was technically within the normal laboratory range, but functionally deficient for an adult his age. 3 months of supervised B12 supplementation later, he told me, and I remember his exact words, "Dr. James, I feel like someone turned the lights back on." That is what evidence-based medicine, delivered by a real physician who takes the time to look, can accomplish. The fix is simple. If you are on long-term metformin, ask your doctor to test your methylmalonic acid level at your next blood work. That is the most sensitive test for functional B12 deficiency. It is inexpensive and your doctor can order it today. Before I give you your action plan, there is something that ties all 7 of these medications together. And this may be the single most important thing I say in this entire video. It is not just about individual medications. It is about the total cumulative burden on your brain. A 2021 meta-analysis confirmed a dose-dependent relationship between cumulative anticholinergic exposure and dementia risk. The more anticholinergic medications you take, and the longer you take them, the higher your cognitive risk climbs. Not in a straight line, exponentially. I have personally seen patients on 2, 3, sometimes 4 anticholinergic medications simultaneously, each prescribed for a legitimate medical condition by a physician who did not know what the others had prescribed. No single medication looked dangerous, but together, the combined cognitive burden was devastating. This is called polypharmacy, and it is one of the most under-recognized threats to cognitive health in adults over 60 in this country today. There is a clinical tool called the Anticholinergic Cognitive Burden Scale. Physicians use it to calculate your total anticholinergic load across all medications combined. Most patients have never heard of it. Most routine appointments never calculate it, but you can ask for it. Those 4 words, "What is my anticholinergic burden?" could change the trajectory of your cognitive health. Here is exactly what I want you to do, starting this week. Step 1. Write down every single medication you take. Prescription and over-the-counter. Every pill, every sleep aid, every supplement, everything. Step 2. Bring that list to your physician and ask this exact question. Are any of these medications on the Beers criteria? And what is my total anticholinergic burden score? Those are real medical terms your doctor will understand immediately. Step 3. If you are on long-term metformin, ask for a methylmalonic acid B12 level test at your next blood draw. Inexpensive, simple, potentially transformative. Step 4. If your doctor suggests reducing or replacing any medication, never stop abruptly on your own. Benzodiazepines especially require a careful, supervised taper. Stopping suddenly can cause seizures. Always under your physician's guidance. Step 5. Understand this. What I most need you to hear. This is often reversible. Many cases of medication-induced cognitive impairment improve meaningfully when the cause is identified and addressed. What feels like aging may be pharmacology, and pharmacology can be changed. I want to be absolutely clear. This video is medical education, not personalized medical advice. Do not stop any medication without speaking directly with your physician first. Every patient is different. Every clinical situation requires an individualized conversation. What I have given you today is the knowledge to have that conversation as an informed, empowered adult. Many cases of what appears to be age-related memory decline are actually medication-induced cognitive impairment. And that distinction matters because it means the damage can often be stopped and partially reversed under proper medical care. If this video gave you important information, please share it. Send it to someone over 60 who takes daily medications. This video could genuinely protect someone's brain. Subscribe to this channel if you have not already, because in the next video, I am covering the 5 nutrient deficiencies that are shockingly common in adults over 60 and directly linked to accelerated cognitive decline. That video gives you the nutritional strategy to rebuild the exact brain pathways we discussed today. I am Dr. James. Your brain has carried you through an entire lifetime. As your physician, I am committed to making sure it keeps doing that for decades more. I will see you in the next video.